Hi, I am Taylor Johnson. My topic will be on nurse burnout, and this is for Nursing 435 Management in Nursing. So, for my objectives for this presentation, those listening will be able to understand the definition of burnout and how prevalent and how often it happens in the profession. You'll be able to identify signs and symptoms and how it directly affects patient care and how management can have an effect on burnout, but they can also experience burnout themselves. And we want to avoid it and improve it and prevent reoccurrence. So, starting with the overall definition of nurse burnout, it's just physical and mental exhaustion, distancing yourself from your job. So, I don't want to go to work. Work is just not a place you want to be. You can also feel like angry and bitter towards your job for a multitude of reasons. Nurses under the age of 25, so new grads for the most part are most at risk. 69% feel burnout, and that's usually pretty soon within their nursing profession. This is a very complex issue because it not only affects staff nurses, but managers and leaders included experience burnout. It's a different type of burnout in a sense, but we'll talk about that later. And unfortunately, right now, there's no foreseeable end to nurse burnout given the state of the current healthcare system with staffing shortages and high patient volumes with an aging population. So what exactly the effects of nurse burnout? It increases nurses' risk for a lot of mental health issues, including suicidal ideation, substance use, depression, anxiety, you name it. They're at risk for it. These also include physiological and psychosomatic issues. The biggest effect of this is it decreases patient safety a lot. When you're burnt out, you really just don't care because you distance yourself from your job. It's a trickle-down effect. So you start saying, oh, I'm just going to skip this round because they were fine an hour ago. I'm just not going to list this in the charting because it's not important. It starts small but ends up being really big. That includes the starting of burnout and the effects of burnout. So in this picture on this slide, this also goes with my next slide coming up, which is the patient safety and quality of care. So I think it's pretty severe that burnout increases mortality for patients. So we'll talk about patient safety and quality of care next. So like I mentioned in my last slide, patient safety and quality of care, something that leads to nurse burnout, which is a whole nother issue in itself, is high patient ratios at the moment, which is also due to staffing shortages, which is also a whole nother issue in itself. But when you have a high patient ratio, you are at a much higher risk for not finishing or mischarting. These unfinished or missed care tasks can lead to adverse or sentinel events, which are not good, Also with high patient ratios that lead to burnout, and also when a nurse is burnout, you don't have the mental capacity to adequately assess, build relationships with your patients. It's just really hard to make a difference and really dig deep into their health and their, social history and all of that we have a responsibility for as nurses to see the whole patient as a whole and not just their medical problem. For the financial aspect of burnout, patient safety and quality of care are the most reliable forms of hospital performance measurements. And that's huge. You want to think of HCAHPS, like how do hospitals receive their fundings? If quality of care is decreasing, funding gets cut because patients are not happy. Why would the government want to give money to hospitals that are not rated very well, you know? If patient safety is decreasing, insurance won't pay the hospital. CODIs, falls, you know, insurance won't pay for that. Readmits for congestive heart failure. Because we're not providing the education to these patients for like congestive heart failure, and then they get readmitted. Insurance isn't going to pay the hospital for that, and then jobs get lost because there's no money coming in for those wages. So it's kind of a vicious cycle. It's just unfortunate. So this is like the biggest thing that we want to focus on for nurse burnout. So these things are avoided. So hospitals can be funded, so patients are getting quality care and they're safe. That's our number one priority, is safety for our patients. So moving on to assessing for nurse burnout. This includes management assessing their staff. This includes staff assessing each other, picking up on the signs and symptoms of burnout. I thought this was a nice little visual, this picture here. It kind of breaks down the signs in the different domains. During my research for nurse burnout, I actually stumbled upon there are actual assessment tools to measure burnout in people. But like my first bullet point says, they really have only been used in studies so far. They're not used on a regular basis. But burnout assessments have been shown to improve workplace environment. That doesn't mean they're necessarily using these specific burnout tools that I have listed on the slide. But I think it should be implemented because it would be like a more accurate indicator. The core tools assess for like the hallmark signs like exhaustion, mental distancing. That is the first burnout assessment tool. The secondary assessment tool is for like psychosomatic issues. So like it incorporates the physical health as well. And also this assessment should be completed from the top down. So, you know, all sectors of healthcare as well. So managers, staff, nurses, aides, you know, presidents, everybody, every unit, outpatient, you know, you name it, they should be screening for it. Screening for it is the first step in trying to solve the issue, because you can't solve the issue without knowing how big the issue is in the first place. So after assessing for burnout, the next step would obviously interventions for burnout. Really, interventions will vary based on person to person. Some people might want to do yoga. Some people might want to take up long distance running, maybe crocheting. Whatever floats your boat. There were 2 studies that I found while doing my research that mindfulness training and compassionate care education were 2 training / educational programs, kind of like a continuing education type deal, that helped improve burnout in those facilities. Mindfulness training is basically stress management. So it kind of gives ideas on like ways to manage stress, but you know, physical exercise, eating healthy, all that. Compassionate care education was obviously more patient directed. Really just put an insight on like a patient's perspective on the care that nurses are giving. Really, any intervention that will help decrease burnout should be heavily encouraged, both inside and outside of work. So like something that a person can do on their lunch break, or even just encouraging making sure these nurses take their breaks will help burnout immensely. All of this also ties back to HCAHPS, because if the interventions of burnout is working, these nurses are going to be providing better care and will get more funding and more full-time positions, and nurses will be happier also. It improves their quality of life. I like this picture over here. Self-care isn't selfish. We have been taught since the beginning of our program, we cannot pour from an empty cup, and I think that is more true now more than ever. With staffing shortages and the perpetuating burnout, we really need to be looking out for ourselves and looking out for each other. And I think that goes both ways, to management and staff to management. So the 3 theories that I think go well with nurse burnout is Levine's conservation principles, Lewin's change theory, and then transformational leadership style. For Levine's conservation theory, it really focuses on the conservation of energy, conservation of structural integrity, and personal integrity also. Protecting your energy really is described as like protection from over fatigue. So that right there is like the whole premise of burnout. Structural integrity is your physical and health and strength. So that also ties into burnout. You know, burnout really affects your mental and physical health. And personal integrity is the recognition of self-respect. So we need to know our limits. We need to know when to say no, when to say, I need to do something to help myself feel better so I can therefore provide better care for my patients and my people. Lewin's change theory has the 3 stages, like in this picture right here. The unfreezing, I'm sorry. It's really just like recognizing that there's a problem, changing the problem, and then evaluating the change to see if it helped the problem. In the transformational leadership, during my research for nurse burnout, I found that transformational leadership really like inspires and builds trust in your staff. It really empowers the staff, and so it makes them feel like they're capable, which helps burnout in the sense of like they don't second guess themselves and lead to like emotional distress. You know, they feel confident in their ability to provide proper care and adequate care, and they thrive on that. And I thought that was really cool. So as I mentioned at the beginning of this presentation, management and leadership, they're not immune to burnout. They also have a lot of responsibility. They deal with scheduling, fiscal responsibility. It's not like direct patient care burnout, but it's burnout nonetheless. It still affects them mentally and physically and has all the same characteristics. Given that, managers are also big influencers of improving nurse burnout in their employees. In my research, mental health screenings during employees' reviews, flexible scheduling, and support and encouragement for needing to take time off work were super big indicators of improved burnout in nurses. So I also found that some healthcare facilities are implementing emotional health and well-being policies that require screenings and check-ins throughout the year. And I think that should be universal. So many things can affect mental health, given it be work-related like burnout or private life stressors that is super important to keep checked in with. And managers would be responsible for making and overseeing these changes, which again adds to their workload, which could perpetuate their burnout. But it also helps their staff, and I think that is super important as well. Given all this information, like, managers and leaders walk a fine line between avoiding burnout themselves and also helping their staff with their burnout. It makes their job all the more hard, but super influential also, you know. I think there's something really important to be said about a manager who can admit when they're feeling burnt out and being like, I'm human and I need to take time for myself too. And because I think that sets an example for the staff. So to wrap things up here, burnout is just a really serious issue. We really need to start making changes for it. It will probably take many, many years, but we will hopefully get there. We need to remember that nobody is immune to burnout. We all need to be looking out for each other. We need to be looking out for our managers. Our managers need to be looking out for us. Staff nurses need to be looking out for each other. It's a team effort. Patient safety and quality of care would greatly benefit from decreased nurse burnout. And hospitals would get better funding for that. We really just need to work together, and decreasing nurse burnout and improving patient safety and quality of care just really would better the entire healthcare system. We just need to work together to move up. Yeah. Thanks for listening.